Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. For today, we'll be talking about mistletoe therapy. So, I'm sure you've heard of what mistletoes are, especially during Christmas, right? We have mistletoe, and you kiss somebody underneath a mistletoe, right? So it's the same plant. So actually, mistletoe is a group of plants that are what we call parasitic. So they live off other plants, which is usually from trees. No, so there are also different kinds of mistletoe. There's scientific name of mistletoe is actually from the Viscum family, so it's called a Viscum album. And then there's also other varieties. So there's could be Viscum album from Pini or Mali. So depending on which kind of tree the mistletoe is growing from. No? So how did mistletoe therapy started? Actually, it started by a certain Dr. Rudolf Steiner, which is the one who also started the anthroposophic school of medicine or anthroposophic medicine. So he used a lot of these herbs as a form of treatment. So it's called anthroposophic medicine. So one of the things that contributed to this is the mistletoe. No? So they use a lot of mistletoe in cancer, especially in Germany and all across Europe. No? So a lot of studies have already been done on mistletoe in breast cancer, colon cancer, ovarian, endometrial. So all these called endocrine tumors. No? So also they've been shown to have some activity in patients with leukemia. Okay, or those who also have lymphoma. So there seems to be a very good track record for mistletoe. Okay, so the only reason we're not hearing mistletoe here in Asia as well as I'm sure if you read a lot in the United States, because mistletoe is still not approved as a medicine for cancer. No, but in Europe, no, it is recognized as a therapy or as an adjunct to standard or conventional therapies, no? So, how do you use mistletoe? So, you can use mistletoe together with chemotherapy, radiotherapy, or if you can also use it as an adjunct to other complementary therapies. Okay, so normally here at our center, we give mistletoe. Usually, they come in ampules. Okay, so they could come in like a box of 7 or a box of let's say 50 or 100. So usually they give mistletoe, you take mistletoe injections 3 times a week. So we give that injections subcutaneous, no? So we give increasing dosage of mistletoe. What we want to do, or what mistletoe does in a very good way, is it boosts our immune system, no? So mistletoe actually after injection will kind of create a certain fever, or what we call fever response, no? Which is good. You want to have a fever response because cancer in general, they want to live in a cooler environment. If you put the body into a higher body temperature from let's say 38, 39, 40, cancer cells isn't able to thrive as well as in a lower body temperature. So as you may know, especially those who have cancer, no, if you check your temperature in the morning, your temperature sometimes would be hovering between 35, 36. Rarely will your temperature be in the 37. So one of the things, or one of the ways to increase your body temperature is actually to use mistletoe, no? So aside from increasing body temperature using mistletoe, you can also use sauna, infrared sauna. You can use steam sauna. You can use beds, those beds that generates heat. So anything that would increase your body temperature is a very good way, or a very good therapy for patients with cancer. So aside from mistletoe giving you a fever response, it also can increase or stimulate the production of what we call the white blood cells, okay, specifically lymphocytes. So Actually, lymphocytes are the type of white blood cells that you really need to fight cancer. So aside from lymphocytes, there's also what we call natural killer cells. So when you do inject mistletoe on a regular basis, you're actually stimulating more lymphocytes and more of these natural killer cells to help your body fight against these cancers. No? Now, we also give patients with let's say they're doing chemotherapy or radiotherapy. So one of the ways we can help them boost their immune system is to give mistletoe therapy, because as you well know, when you do radio and chemotherapy, your immune system would be drastically affected. Okay, so we give mistletoe also during their in between their chemotherapy sessions, or when they are doing their radiotherapy. So aside from cancer, whether it's solid tumors like breast, ovarian, colon cancer, we also can use, which we have very good response in patients with lymphoma. So patients with lymphoma seems to have a good response when we give them mistletoe subcutaneously. Now, there's a new way now of doing mistletoe. It's been widely used now in Europe and rapidly gaining ground in the United States, which is using mistletoe intravenously. Okay, before this, all the major studies on mistletoe were actually on subcutaneous injection. So now they're giving IV mistletoe injections. Okay, so how do you do IV mistletoe? We usually start them on a 15 milligram dose and then drip it for about 2 hours. Now, the reason we give 50 milligrams at a very low or a very slow is because a lot of patients, or most of patients, if you give them an IV drip of mistletoe very fast, they might develop some form of what we call pseudo allergy. So they might turn red and flushing on the skin. So, but this is quite normal. So just to avoid it, because some people become afraid. To avoid this, we give the mistletoe in a low drip, usually for 2 hours, and then we increase the IV mistletoe drip. 50 milligrams, 100, then 200, then some can go as high as 2,000 milligrams of mistletoe. Now, where do they find best benefit for those doing IV mistletoe? They found out those patients on palliative care. So when you say palliative, they're in this place wherein the doctors say they have no more treatments for this person, or this person is beyond cure, so we just wait for them to go away. So one of the things they did was, during their palliative care, they were giving IV mistletoe. So what they found out is those on IV mistletoe actually live beyond the duration wherein doctors were expecting them to die. So they found out that IV mistletoe is a very good agent also in patients who are already under palliative care. So we do here at the center, we do believe that when we combine a mistletoe with all the other therapies that are available, we get a better response from therapy. Number 2, better quality of life. And number 3, extend their lifespan, because I think that's one of the most important thing when we talk about cancer treatment. How do we extend quality of life, and how do we expand their life without them suffering, right? So what is the use of being alive if you're suffering, right? So when we do therapies like mistletoe, we are extending life, but we're also extending their quality of life, which is one of the things that we really need to consider when we're actually going to do therapies for cancer. So does this extend your life, and does it improve your quality of life? So now, going to the side effects of mistletoe. So when you do injections, again, you will develop fever. Usually the fever would last just overnight, okay? And then the next day, you might have a small reddish patch where you did your acupuncture. So, acupuncture, your needle insertion. So if you did your ejection on that area, the next day there will be a small patch, which is very normal. Okay. So, but when the patch becomes bigger than, let's say, a 5 peso coin, then that means that you're getting too much. Then we have to sort of lower the dose. No. So actually, mistletoe is I would say, a very cost-effective treatment. I wish more doctors would be familiar and be able to use this product. No? So, but currently there's not much doctors who are aware or willing to try mistletoe, but it's very safe. I mean, there's no severe, or how you say, adverse effects that would really affect or make you suffer. No? So I think that's one of the reasons why we like to use mistletoe here at our center. Again, if you have family or friends who are diagnosed with cancer, it's not the end, it's not a death sentence. There are many ways to address or treat cancer. We just need to be aware and conscious of all the options that are available. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health, or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.